Kia orana, everybody. Welcome back and good afternoon. I hope you all enjoyed that long break. I know some of us, it's not a break, it's also work during our break time. So now we are back we will resume back into consideration of agenda item 7, the address by and report of the regional director. As usual, if you wish to speak, you all know and understand what to do. So we will resume back with our representative from Marshall Islands. Thank you.
Madam Chairperson, distinguished colleagues and Dr. Saia, on behalf of the Republic of the Marshall Islands and with heartfelt acknowledgement from Her Excellency Dr. Hilda C. Aini and the government of the RMI, I extend our warmest congratulations to you, Dr. Saia Mau Piukala, on your outstanding leadership as the regional director. You have demonstrated extraordinary commitment by visiting over 20 countries, engaging with leaders across sectors, and building the partnerships that are essential to improving health outcome across our region. Your work has already made a significant impact, and we deeply appreciate your dedication. Your report highlights both the progress we've made and the challenges that lies ahead. The lessons we've learned from COVID-19 pandemic are invaluable, and your vision of revitalizing universal health care is a call to action that we must all heed. Ensuring that every person has access to quality health services without financial hardship is not just an objective, it is a moral responsibility. Your new vision for 2025-2029, Waiving Health for Families, Communities, and Society, resonates profoundly, like the woven mats that hold deep cultural significance across the Pacific. This vision underscores the strength that comes from collective action. Each strength represents the contribution and effort of government, partners, and communities coming together to build something resilient and enduring. In the Marshall Islands, we live with dual realities of changing climates and nuclear legacy that continues to affect the health of our people. The rising seas and displaced communities are immediate threats, but so too are all long-term health impact from nuclear testing. The nuclear legacy remains a significant part of our history, an ongoing challenge that we must address for the health and well-being of our future generation. Your leadership, Dr. Saia, in addressing health inequities and climate resilience is crucial as we continue to confront these challenges. There's a Marshallese proverb that guides us, Waguk Wajumor. A canoe joined together brings strength and life. This wisdom speaks to the power of unity and collaboration, just as a canoe, when built and paddled together, can navigate most treacherous water, so too can we. Through collective action, outcome the complex health challenges we face in the Pacific and beyond. I would like to take this opportunity to warmly invite you to visit Marshall Islands. It would be an honor for us to welcome to you our home, to share with you the resilience and strength of our people, and to further our collaborative efforts toward health and equity sustainable development. Dr. Saia, your vision and leadership inspire us all, and we look forward to continuing this journey together, weaving a future where health is fundamental right for all, and no one is left behind. Thank you, Komotada.
Thank you very much, Honorable Minister from Marshall Islands. Now we move on to representative from China. Thank you. Can you push the button one more time?
Oh, okay. 谢谢主席。
Thank you,
中
Madam
方
Chair.
祝贺并
China
感谢区域
congratulates
主
and
任
thanks the RD,
Saia Piukala 医
Dr.
生
Saia
和各司
Piukala,
局负责
and
人
technical
所做
division
的
directors
详细的
for
工
the
作报告。
informative work
报
report,
告全
which
面
has
总结了西太
comprehensively
区过去一
summarized
年
the
在
highlights
各业务
in
领
the
域
operations and
和
the
治理
governance from the
管
last
理工作
year,
中取
as
得
well
的工
as
作亮点、
valuable
宝贵
experiences,
经验和问题挑战。
issues, and
中方
challenges.
赞赏皮乌卡
China
拉医生
commends
就任区域主任以
the
来，
robust
对本区域卫
continuation
生发
and
展成果的
advancement
充分
in
延续
regional health
和有
development
力推
outcomes
进。
since Dr.
中方
Piukala
感谢
took
区域主
office
任
as the
上任
regional
后
director.
访问
We
超
thank
过
the
中国在
RD
内的
for
22
visiting
个国家，
22 countries,
亲自
China
了解成员
included,
国
to
卫生
learn
健康事业
firsthand
发展的
the
第
health
一手信
endeavors
息，
in member
倾
countries,
听各
to
方的
listen
需求，
attentively to the
以
needs
及
from
需要
all
世卫组织
quarters
提供
and
的
the
支持。
support needed
中
from
方对此表示
WHO.
感谢。
China appreciates
同
such
时，
efforts.
区域主任表
At the
示
same
将
time,
持续提
RD
升
says
国家
he will
办事
continue
处
to enhance
的
the
工作能
capacity
力与
and
授权，
authority of
进一
country
步增强
officers
世卫组
and
织对
further
成员国
improve
需求的
timely
及时反
response by
馈。
WHO to
这
the
充分体
requirements of
现
members.
以国
That
家为
has
中
fully
心，有
demonstrated
助于提升世卫
country-centered
组织的工
approach
作效
and will
率与质
enable
量。
greater
中方对此
efficiency
表
and
示赞
qualitative
赏。
work, which China
我们支持
applauds.
区域主任
We
今天
support
介绍
Regional
的
Director's
共建西太
presentation
区
of the
西太
new
区
vision
家
for the
庭、
next
社区
5
和社
years
会的健
in the
康，
document
共同
Weaving
努
Health
力
for
改善
Families,
健康，
Communities, and
提升福
Societies
祉，
in the
拯
Western
救生
Pacific
命的未来
2025 to
5年的新愿景
2029.
文件。 很高
It
兴
is
派出
our
代表参与
delight
了
to
这一
send
愿景文
delegates
件
to
的起草和
participate
磋
in the
商工作。
drafting and
中方
consultation of
同
the
意
vision
新
document,
愿景规
and
划
we
的5
agree
个
with
重
the
点的工
5
作领
working
域。中方
priorities.
认为，
China
这一愿
believes
景
this
既与
vision
世卫组
is
织的
in
第
high
14个工作
alignment
总规
with
划
the
一脉相
GPW
承，
14
也
and
是实
its
现全面健
important
康覆盖
pathway
和
to
2030年可
realizing
持续发展议
UHC
程
and
健康目标的重要
2030
路径。
health-related
同时，
SDG.
这也是中国今年7月份召开的党的20届
In
三中全
July,
会以来
on the
确
third
定的
plenum of
医
the
药卫生
20th
事业改革
CPC
和健
plenary
康优
session,
先发
it
展
is
战略的
also
重要方
the
向，
health
这都
priorities
是契合的。
decided by the
下一步，
party.
中方愿
All these
同
are
西
in
太
high
区和
alignment. As
各
to the
成员
next
国
steps of the
分享
region,
关于药
China
卫生
has
体制
two
改革的
expectations.
具体举措。 关于西太区的下一步行动，中方有2点
We
期
have
待：
these
一
two
是希望区域办事处
expectations.
切实推动同
First,
成
we
员国
hope
加
the
强人
regional
力资源的
office
合
could
作， 不
earnestly
断提
promote
升本区域
cooperation
内国
with
家的人员代
members
表性
to
和
beef
全球
up
卫生
human
的能力。
resources
中
so
国
as
政府
to
也将继
constantly
续支
improve
持西
country
太区实
representation
施
and
全球
global
卫生
health
学习中
capacity
心的
in the
项目，
region. The
欢迎
Chinese
各国
government
积
will
极参
continue
与。
to support the
2
regional
是希望
implementation
区域
of
办
the and
世卫组织
welcomes the
合作
active
中心等
participation by member
主体，
countries.
有
Second,
效地
we
发
hope
挥
the
世卫组
regional
织合
office
作
will
中心
continue to
在
focus
全球
on
卫生治
WHO
理和发
collaboration
展中的
centers and
作用。
other
借
entities
此
and
机会，
effectively
中方也特
leverage
别
their
感
role
谢
in
西太
global
区
health
对世卫组
governance.
织在华合
China
作
would
中
like to
心工作
avail
的
this
大力支
opportunity
持。
to thank BPRO for
展
its
望未
vigorous
来，
support to
中方
WHO
愿继续
Collaboration
与西
Center
太
in
区
China.
各业务司
Looking
局
ahead,
共
China
同
is ready to continue
各
to
司
work
局
with the
共同
BPRO
实施
technical
中国
divisions
世卫组
to
织合作
jointly
战略，
implement
愿同本
CCS,
区域成员精
dedicatedly
诚合作，
cooperate with regional
巩固互
members
信，
to
推动
solidify
世卫
our
组织
mutual
第
trust
14个工作
and
总规划
smoothly advance
和西太区
GPW
新
14
愿景
and the
的
new
顺
vision
利
of
推
the
进，
region,
共同
with
编
a
织一个
view to
更健
jointly
康、更
weaving
安
a
全的未来。
healthier and
谢谢主
safer
席。
future. Thank you, Madam Chair.
Thank you very much, our representative from China. Now we move on to Japan. The floor is yours.
Honorable Madam Chair and Vice Chair, and our Regional Director for Western Pacific, and Assistant Director General for Universal Health Coverage from headquarters, but originally from this region, and honorable ministers, distinguished delegates, ladies and gentlemen, I'm deeply honored to have this opportunity to speak today on behalf of the government of Japan. First and foremost, I would like to express my sincere appreciation to Dr. Piukala, WHO Region Director for the Western Pacific region, for your exemplary leadership since assuming the office in February this year, as exemplified by your initiative on weaving health for families, communities, and societies. Japan stands ready to work even more closely with you and with other member states to tackle the pressing health issues facing the whole Western Pacific region. As highlighted by the regional director, achieving universal health coverage for all people by 2030 is a critical goal, requiring a renewed and unified approach. Japan achieved universal health coverage back in 1961 and has maintained and developed this accomplishment for more than 60 years, ensuring equitable and high-quality healthcare services for all citizens. We are confident that Japan's experiences and lessons, including both successes and failures, can contribute to strengthening health systems, not only in the Western Pacific, but also globally. As such, Japan is working with the World Health Organization and the World Bank to establish the UHC Knowledge Hub in Japan by 2025. This global center will gather insights and foster human resources to assist countries in achieving universal health coverage. Another critical challenge we face is the impact of the climate change on health. In the Western Pacific region, climate-related disasters are becoming more frequent and severe, causing health-related damages and straining healthcare systems, posing a grave threat to people's livelihood. Drawing from our long history of battling numerous disasters, including typhoons and earthquakes, Japan will continue to share its experience in disaster risk management and contribute to strengthening international disaster response capabilities. For instance, we will work to establish a medical care provision system in times of disaster. We believe this would help to build up climate resilience across the whole Western Pacific region. Madam Chair, Japan remains committed to advancing international cooperation to safeguard the health and well-being of all people, those residing in the Western Pacific in particular. Let us work together by mutually sharing our knowledge, experience, and innovations to create a better future together. Thank you for your attention.
Thank you very much. Now, delegate from Japan. Now we move on to Australia. Australia, thank you.
Thank you, Chair. Can I also acknowledge you as the first female Pacific Chair, and as the Fiji colleague, I think, noted, our first female Chair and Vice Chair in this Western Pacific meeting, so I think that's great, another first. It is good to be here today with you as Western Pacific colleagues, and I'm now going to try and use that word as often as possible, as we tolaulanga together, close, hope I got that right. Can I join others and thank Dr. Piukala and the team for this first regional committee meeting and the great welcome that we've had today. My Minister, the Honourable Mark Butler, asked me to pass on his warm regards and apologise that he can't make it this week. In response to the report this morning and all that we've heard from the directors, Australia wants to highlight 4 areas. In regards to the regional vision document, we thank you not only for the document but for the way you went about preparing it. It was an exercise and a model that you set in weaving and bringing together the members that brought it together, so thank you for that. We particularly commend the focus on tangible actions and targets for our region. It has a vision and it has targets. We endorse the focus on health equity, addressing the impacts of climate change on health, strengthening primary healthcare capabilities and delivering digital health and innovation. These priorities, I think, resonate with much that we've heard this morning and much in the discussion over the last 2 days. We're also particularly pleased that the vision applies an equity and inclusion lens to WHO's work in the region and encouraging the implementation to see a focus on scaling up gender-responsive, disability, culturally and sexually inclusive approaches so that all people can have access to the quality healthcare they need without discrimination. We call out and commend Wipro's efforts to scale up country office capacities, particularly in the Pacific, and improving workplace culture across all offices. We've heard a bit already around sustainable financing. To deliver the full impact of the General Program of Work 14 and the Regional Director's vision, we reiterate the importance of ensuring member states are providing for the organisation with flexible, predictable and sustainable funding. I know we'll be talking about this more in the next few days. We acknowledge that the post-COVID pressure on our budgets, both domestically and internationally, but Australia still wants to emphasise the importance of maintaining momentum towards the full potential of the member state sustainable financing agreement. In lockstep with the funder request, though, we highlight and appreciate the ongoing efforts to improve WHO's governance and financing arrangements. In regards to the pandemic agreement, Australia remains committed to the reforms to the global health architecture to achieve better outcomes for all countries in responding to future pandemics and public health emergencies. The current MPOX fate is an important reminder of the need to act on lessons learned during the COVID-19 pandemic. Like others here, I was in the room earlier this year in Geneva, where the member states' efforts in securing a historic agreement to the IHRs was clear. It wasn't easy, and finalising the pandemic agreement won't be easy either. But we encourage WIPRO members to continue this momentum towards finalising the pandemic agreement. Australia was happy to join the Intergovernmental Negotiating Body Bureau as the Vice Chair for this region. In that role, we remain open. In fact, we count on your collaboration and your message and support to help us shape that agreement and land it in the time that we need. We also look forward to working with WHO and partners to support implementation of the amended IHR in the region, which Australia is actively working towards now. And lastly, recognising the diversity of region is one of our key strengths. We note the importance of elevating the voice of all member states through equitable arrangements in WHO committees across the board. Thank you.
Thank you very much, our delegate from Australia. As we continue with interventions, I would like to ask all members who wish to speak to please do not push the button. The system will automatically push that for you. So thank you. Now I invite our delegate from Singapore. Thank you.
Thank you, Chair. Singapore would like to first express our appreciation to Regional Director RD Dr. Piukala for his able leadership over the past 8 months. We also thank all WIPRO staff for the outstanding work done over the past year. As we look forward into the future, I'm encouraged by the vision set forth by RD, which is aligned with our collective goal of achieving universal health coverage and health for all. Singapore fully supports the 3 Ps raised by RD: to promote, provide, and protect. Allow me to share 3 points. First, we must confront the growing burden of non-communicable diseases, NCDs, in our region, which account for a significant proportion of morbidity and mortality. The rise in unhealthy lifestyles, such as the use of tobacco and nicotine products, alcohol consumption, poor dietary habits, contribute substantially to the prevalence of NCDs. We must double down on our health promotion efforts to empower individuals with the knowledge and resources they need to make healthier choices. Second, we must continue to adapt our healthcare delivery to more effectively manage health conditions. In 2023, Singapore rolled out Healthier Singapore to invest in primary and preventive care, reduce the prevalence of chronic diseases, and moderate the increase in healthcare expenditure. By strengthening our primary healthcare system, we aim to manage and reduce avoidable diseases before they become more serious and move care closer to residents, ensuring that we provide accessible healthcare in the community. Third, we must protect our populations against health threats and not forget the lessons we learned during the COVID-19 pandemic. To this end, Singapore's contribution of 24 million Singapore dollars to WHO's investment round will go towards improving member states' protection from health emergencies and building their public health capacities. Domestically, Singapore is also setting up a new communicable diseases agency to enhance our preparedness and readiness for future infectious disease threats. We look forward to working with member states to strengthen the region's health security. The world is rapidly changing and becoming more complex, which can make it more challenging for member states to achieve universal health coverage. As RD pointed out, health achievements are products of collective action, and Singapore looks forward to the continued partnership with WIPRO and fellow member states to advance the new 5-year vision and improve health and well-being for all. Thank you.
Thank you very much, our delegate from Singapore. Now we move on to Mongolia. Thank you.
Ms. Chairperson, Regional Director Dr. Saia Piukala, Honorable Ministers, distinguished delegates and ladies and gentlemen, Mongolia extends its deepest gratitude to the Western Pacific Regional Office and the Regional Director for their leadership and commitment to enhancing healthcare systems. We commend WIPRO for their visionary approach for the future towards the healthiest and safest region framework. Ms. Chair, Mongolia has launched a new public health law, recognizing the complexities of its implementation. We are also establishing centers for disease control and prevention, which requires careful planning, strong leadership. With WHO's support, we are confident in managing the challenge and successfully establishing a CDC. Mongolia appreciates WHO's support in responding to disasters, including 2023 floods and the extreme winter event known as Sud. Mongolia completed joint external evaluations to assess capacities for preventing, detecting, and responding to public health risks. The findings from the evaluations guided the strengthening of our system for health emergencies, and we are privileged that with WHO's support, Mongolia has obtained financing from the Pandemic Fund to support our efforts. Ms. Chair, in concluding the address, Mongolia would like to thank WHO's support and those with other partners, and for empowering WHO country representatives through greater delegation of authority, enabling them to respond quickly to our needs. We would like to take this opportunity to thank Dr. Socorro for her continued support and guidance to Mongolia. Mongolia is proud to be part of Western Pacific region and looks forward to continued collaboration with WIPRO to achieve our shared vision for health and well-being. Thank you, Regional Director Dr. Saia. I call all to come together and work together. Thank you.
Thank you very much, our delegate from Mongolia. Now we move on to Palau.
Good afternoon,
Thank you.
Honorable Chair, Regional Director Dr. Piukala, Honorable Ministers, distinguished delegates, ladies and gentlemen. Palau takes the opportunity first and foremost to thank the outgoing Chair of the 74th Regional Committee for his commendable leadership over the past year. And I wish to also congratulate the incoming Madam Chair, Vice Chair, and all officers of this 75th RC for your appointments. I look forward to the work we shall undertake together with you this week and for the coming year. I'd also like to congratulate once again Dr. Saia Piukala for assuming his role as our regional director, and to thank Dr. Piukala for his recent in-country visit to Palau. Palau appreciates and supports the 2025 to 2029 regional vision of weaving health for families, communities, and societies, and we pledge our commitment to continue working together with the RD and the WIPRO office to advance health and human development in our region. Excellencies, ladies and gentlemen, our region is at a crossroads of history. As we proceed down the road to recovery from the impacts of the COVID-19 pandemic, we yet face many health challenges, including our ongoing fight against non-communicable diseases, the developing mental health crisis, the increasing threats of climate change, as well as health systems challenges, including workforce deficiency and supply chain issues. In addition to these, across the region, we are seeing declining birth rates, aging populations, and we remain vulnerable to the volatile impacts of inflation and global economic instability. This calls for stronger partnerships and deeper collaborations within our region and with global partners and neighbors to address these emerging and re-emerging challenges. Particularly as we continue our work to bridge the arbitrary gap between health and climate change, I strongly encourage all of us in the region to do more with mitigation and adaptation to the effects of climate change on human, animal, and planetary health. This is particularly concerning for small Pacific Island states who are among the least of contributors to climate change, but are among the worst affected by it. For many of us, climate change, sea level rise, and NCDs are the gravest threats yet to our future existence. But we should not be discouraged nor lose hope, as we in this very committee hold the key to safeguarding not only our region, but the world's fate against the worsening effects of climate change. Let us strive to do our part and hold accountability for both our actions and inactions in the face of this existential threat. Lastly, as rightfully highlighted by the RD, we should always take the time to acknowledge and appreciate the tremendous efforts and hard work that our workforce undertakes day in and day out, despite challenges, to serve the people and communities of our region. For without our dedicated workforce, our words and commitments remain as words and are left as empty promises. I congratulate you once more, Madam Chair, and I look forward to a productive and successful 75th Regional Committee meeting this week. Thank you, Madam Chair.
Thank you very much, Honorable Minister from Palau. Now we move on to our delegate from Malaysia. Thank you.
Thank you, Madam Chair. Honorable Regional Director for WIPRO, Dr. Saia Piukala, Excellencies and distinguished delegates. On behalf of the Malaysian government, permit me to extend our sincerest appreciation to the World Health Organization and the Regional Office for the Western Pacific for convening the 75th session of the Regional Committee meeting. We join other member states in congratulating Dr. Saia Piukala on his appointment as Regional Director and commend his remarkable dedication and his team of directors of programs to improving health outcome as reflected and exemplified by the report. Malaysia remains committed to supporting this vision for a social strategy and, to use his word, to weave health, recognizing that concerted actions among families, communities, and societies as moral and political imperatives that are essential in enhancing well-being and saving lives. The past 2 years have undoubtedly been challenging indeed. Nevertheless, the successful conclusion of the IHR amendments exemplifies the strength of multilateralism and solidarity among member states. This achievement underscores our mutual resolve to enhance global health security and preparedness. We are confident this spirit of collaboration will continue as we work together to negotiate and conclude the pandemic agreement within the agreed timeline. As we reflect on the invaluable lessons learned from the COVID-19 pandemic, it is important that we remain vigilant in identifying and addressing emerging health threats, such as the Mpox. A proactive and well-coordinated response is essential in containing the spread of the infection and preventing it from escalating into a more significant public health concern. In Malaysia, key measures include heightened surveillance at international point of entry, bolstering laboratory testing capacity, and increasing public awareness through targeted health education efforts. I have always advocated that robust enforcement is the way to curbing the pandemic or the epidemic of tobacco smoking and e-cigarettes use in Malaysia. I'm optimistic that our recently enacted Control of Smoking Products for Public Health Act will significantly strengthen this effort. This new legislation aims to align with the WHO Framework Convention on Tobacco Control, FCTC, further reinforcing our measures to foster a healthier environment and lifestyles for all. We also look forward to working together to ensure that the lung health resolutions, which we have recently unveiled at the World Cancer Congress in September, get adopted as a global health agenda at the next World Health Assembly. Malaysia is undertaking comprehensive health reforms focused on primary health delivery, promotive and preventive health, sustaining financing, and strengthening human resources as outlined in our health white paper. The reforms also prioritize healthcare digitalization and improve governance. In this regard, significant progress has been achieved in rolling out cloud-based electronic medical records across government health facilities, with a view to finally achieve a national IMR on the lifetime health record as the spine and the strategic heartbeat of a digital health transformation. Last but not least, none of these can be achieved without the synergistic partnership that we have. The Madani government of Malaysia is committed to partnering with various stakeholders, including policymakers, healthcare providers, civil society organizations, and the private sector in ensuring that nobody is left behind as we strive toward achieving UHC and the SDG 2030. Finally, I would like to thank the outgoing chairperson, Honorable Dr. Isham Jafar, Minister of Health Brunei Darussalam, for his outstanding chairmanship. And let me also join others in congratulating Minister Rose Toki Brown from Cook Islands for being elected as the new chairperson. I thank you.
Thank you very much, Honorable Minister from Malaysia. Now we will move on to USA territories. Thank you.
Thank you, Madam Chair. Hafaday, Tiro, and Talofa. The United States Territories of American Samoa, Guam, and the Northern Mariana Islands congratulates Dr. Saia Mau Piukala on a successful year as our regional director and for the comprehensive report. We applaud you and your team for prioritizing the health issues that we are experiencing as a region. We are excited of the new vision, weaving health for families, communities, and societies of the Western Pacific region, a 5-year vision of working together to improving health and well-being and save lives. As it is a true representation of the Western Pacific region, you have indeed inserted localizing solutions for our region. I want to highlight the prioritization of health emergencies and securities in the Western Pacific, as it is vital not only for safeguarding individual health, but also for promoting regional stability and resilience. By investing in strong healthcare systems and emergency response frameworks, we can better navigate the challenges posed by both health crisis and environmental threats, ultimately leading to healthier populations. Health emergencies and security are critical for the Western Pacific region due to the several interconnected factors that influences both public health and economic stability. In the face of health crisis and climate change, such as the COVID-19 outbreak and extreme weather events, disparities have exacerbated the impact on vulnerable communities, highlighting the need for robust health, emergency preparedness, and response systems. In addition, we are grateful for prioritizing data strategy, as it is critical for the Western Pacific region and encompasses public health and environmental management. A robust data strategy is essential for the Western Pacific region to enhance decision-making and improve public health outcomes. And by prioritizing data collections, analysis, and sharing, we all can better navigate our challenges and work towards a more resilient region. Lastly, thank you for your leadership, Dr. Piukala, and WHO for recognizing the health inequity that continues to exist in this region. I am hopeful that the woven mats will eventually provide a collective action for health that includes all of us, weaving, and together we will achieve a more resilient and healthier region for all our communities. Thank you.
Thank you very much to you, our Honorable Minister from U.S. territories. Now we move on to USA. Thank you.
Thank you, and congratulations on your appointment, Madam Chair. Thank you, Regional Director Piukala, for this report on the work to support countries in the region. We also thank all WIPRO staff for their dedication to strengthening health system throughout the Western Pacific. We applaud the work of WIPRO tackling health challenges through technical cooperation to improve the capacity of national health systems, surveillance, risk communication, and support in addressing challenges specific to the many diverse geographies and communities in the region. The United States values our long-standing partnerships across the region and remains dedicated to strengthening WHO. We prioritize equity in all policies, including those promoting sexual and reproductive health, preventing and controlling non-communicable diseases, expanding health security with the One Health approach, and addressing the broader social, economic, and environmental determinants of health everywhere, including in fragile, conflict-affected, and vulnerable environments. The United States supports WHO's whole-of-government approach to achieve universal health coverage and build healthy environments. A multi-sectoral approach is key to building resilient health systems, particularly primary health care, to ensure equitable access to quality health services. We recognize the impact of health financing on public health systems and commend member states who have partnered with WHO to reform health financing and legislation to improve health system governance and service delivery. We welcome the efforts the regional director and his leadership team are making to boost staff morale and nurture a sense of community and camaraderie in the workplace. We believe efforts like Healing Hearts can contribute to improved well-being of the staff, who are our most important resource at WIPRO, and better services for communities across the region. We are also glad to see efforts to address staff concerns regarding challenges with internal bureaucratic procedures, and we are hopeful that measures to simplify processes and increase efficiency will enhance the team's ability to be most effective in their work to support WIPRO member states. Echoing many of our colleagues in the room, we appreciate Regional Director Piukala's vision of weaving together the work of WHO and member states and look forward to the continued discussions this week on building the mat together to increase impact at country level. Thank you very much.
Thank you very much to you, our Honorable Minister from USA. Our next speaker is delegate from Brunei, Darussalam. The floor is yours. Thank you.
Thank you very much. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. And a very good afternoon. Madam Chair, Director General, Regional Director, Excellencies, ladies and gentlemen. First, I would like to like to take this opportunity to congratulate Dr. Vina Tutay Rose-Brown on her election as chair of the 75th session of Regional Committee and the respective office bearers. I'm confident that Madam Chair and the office bearers will do an exemplary job in carrying out the duties entrusted on them. Madam Chair, at the outset, allow me to congratulate Dr. Saia Piukala on his first year in the post as the Western Pacific Regional Director. He has risen to the challenge of delivering for health in this region, and we commend him for his leadership. Dr. Piukala has outlined his vision, weaving health for families, communities, and societies in the Western Pacific region. A powerful statement for collective action in health. In Brunei Darussalam, as we seek to renew our own 5-year strategic plan, we see significant alignment with the priorities outlined in this document, which reflect our own focus on healthcare excellence, the prevention and control of non-communicable diseases, and the protection of public health. The document draws an imaginary of tradition deeply rooted in many of our cultures, that of weaving. In Brunei Darussalam, we too have our own tradition of woven clothes, the kain tenunan Brunei, a national symbol of unity, heritage, and craftsmanship. For all of us, the weaving process serves as a powerful metaphor for the work ahead. Allow me to share 3 reflections on this. First, weaving is a craft passed down through generations. This speaks to the importance of building on our heritage and the lessons we have learned in healthcare. As we move forward, it is critical that we draw upon the strength already achieved. The past few years have seen strengthened focus on putting countries at the heart of the work of the regional office. This country-level support that WHO has provided to meet the unique needs of each member state must continue. In Brunei Darussalam, our partnership with WHO continues to grow. We've joined work to improve national capacities, among others, on One Health, our national health screening program, TB control, and the National Health and Nutritional Survey. We recommend that WHO continue this context-specific collaboration with countries and tailor work to the unique needs and context within each health system operates. Second, weaving requires skill, and these skills must be cultivated. A skilled healthcare workforce is our greatest asset, the thread that holds the system together. As we seek to best implement the strategies outlined, it is vital that we invest in workforce development and retention. Without a well-supported, motivated, and adequately trained workforce, no strategy can succeed. This is why Brunei Darussalam has placed a strong emphasis on health workforce development. And in 2022, we worked to establish the first private nursing college as well in Brunei. And over the last few years, we have invested significantly in digital tools and the appropriate infrastructure needed to support our health professionals. By empowering our healthcare workers with the tools and skills they need, we ensure they can continue to provide the high-quality care our people deserve. And finally, the beauty of the weave often comes from the patterns and images that reflect the environment around us. In healthcare, we too must recognize the importance of our environment. Climate change and environmental degradation are increasingly pressing issues that affect all aspects of health. We are pleased to see climate resilience and sustainability are at the forefront of the region's 5-year strategy. Brunei Darussalam is a committed partner in climate mitigation and adaptation efforts. At the national level, we host the ASEAN Climate Change Center, while as a health sector recently, we launched our sustainability initiative to ensure that our healthcare system is equipped to handle the challenges posed by changing environment. In conclusion, just as the process of weaving requires collective effort and skill, so too does the development of resilient and sustainable health systems. As we move forward together as a region, let us draw on our shared heritage, our collective knowledge, and our united purpose to weave a healthier future for all. We look to WHO to continue guiding us in this journey through focus and practical support that addresses the real challenges we face on the ground. Thank you.
Thank you very much to you, our outgoing chair and Honorable Minister from Brunei Darussalam. Now we will turn to our distinguished delegate from Vietnam.
Thank you, Chair. Dr. Saia Piukala, Regional Director for the Western Pacific, Honorable Minister, distinguished delegates, ladies and gentlemen. Vietnam would like to congratulate Dr. Saia on his first report to the Regional Committee as Regional Director and thank him for his work so far. Vietnam is highly vulnerable to climate change. Recently, the north of Vietnam was hit by Typhoon Yagi, the most powerful storm to strike our country in 3 decades. This typhoon is another reminder of the urgencies of building a climate-resilient and low-carbon sustainable health system. We are proud that Vietnam has joined the Alliance for Transformative Action on Climate and Health, or ATTACH. The Regional Director's report reflects other priority areas for Vietnam, including controlling infectious diseases and enhancing primary health care to make progress toward universal health coverage. Today is a particularly proud moment for Vietnam as we celebrate the elimination of trachoma. The combined efforts of many agencies and communities with the support of WHO and partners organizations have saved thousands of people from lifelong blindness and economic disadvantage. Our children can now grow up safe from these painful and potential blinding infections. This is a wonderful achievement for our people, which will pay dividends for decades to come. Another priority is returning childhood vaccination rates to their previously high levels. In fact, we are proud that the cover of the Regional Director's report shows a child in a mountainous province of Vietnam near a vaccine outreach program. Health authorities have been making enormous efforts with the support of WHO and dedicated local health care workers to ensure routine childhood vaccine protect children in every corner of the country. As the draft regional visions points out, achieving better health outcomes across our priorities require collective action at all levels. We must continue to invest in WHOs to safeguard health, society, and the economy. Vietnam will continue to build a healthier and safer future, relying on the resilience of its people and its long-standing solidarity with WHO. We are sincerely grateful for WHO's dedicated support to Vietnam and this region. Thank you very much.
Thank you very much, our representative from Vietnam. Now we move on to Micronesia. You may take the floor.
Thank you, Honorable Chairperson, honorable colleagues, ladies and gentlemen. A warm ka morale from FSM and a huge congratulations to you, Chairperson, and your office bearers for assuming the leadership role of this 75th RCM. Dr. Piukala, thank you for the comprehensive report. Most importantly, thank you for being you. Well said, well presented, very inspiring and moving. Thank you. You've completed 100 days of work as RD, and very encouraging to note the successes you and your team have brought to the organization. Thank you, and it cannot be said any better. FSM supports a new vision. We are very encouraged to hear your commitment, passion, and humility in steering us forward. In essence, this is what we aspire to achieve. We appreciate the points made in your remark on strengthening health systems as part of your transformative agenda. In particular, we acknowledge WHO's work in the following areas: health sector strategic development, support for pharmaceutical development, NCD, healthy school promotion, EMT, child health, primary health care, and person-to-person exchange and transfer of technical skills. All the above, no doubt, will require additional financing. I commend your efforts and appeal to our partners in this room and out there to continue to work with you to secure additional investment opportunities to get the job done. Lastly, in anticipation of the opening of the CLO in Northern Micronesia becoming an WR, I want to register my utmost respect and support that this becomes a reality. It will deliver results and make impacts at country level. And I think it will contribute to your future success, everybody's future success. Thank you.
Thank you very much to your Honorable Minister from Micronesia. Now we will move on to the Honorable Minister from Samoa. Thank you.
Talofa, talofa, talofa lava. To your Honorable Madam Chair and Madam Vice Chair, to Honorable Dr. Saia Piukala, the Regional Director and the Vice Regional Director. Just before I say something this afternoon, I would like to thank you very much, Dr. Saia, for a very touching and inspiring presentation. To be very honest, you touched my heart and my tears started to come out. And that's very true. And I'm really thankful for the good work. Not only you, but I thank all the directors of various departments of WHO and the officers and everyone who work in this office. It's our office, our regional office in Manila. When I look at this marvelous report, it is not an easy job. Looking at the front page till the end, it's quite a beautiful, and inside a lot of good news and stories about our region. And I thank you very much for your first report in your becoming as a Director General. Just one comment, just put you beside you and the officer of our regional office. I like to suggest in future reports, I want to see Dr. Saia's good lady beside him. Because it's not your job only yourself. Any good man behind is a good woman. And I know you can do anything. And that is the something that I pick up from the report. I want to see your good lady, beautiful face beside you. Thank you. Prime Minister, Dr. Fiume Naomi, to you, the Regional Director, and the Western Pacific region, honorable ministers and delegations, to have a blessed meeting. Today is the starting date of the CHOCOM in Samoa. And I'm the only minister of Samoa who allowed by the Prime Minister to attend this conference because it's very important for Samoa. This meeting is to confirm the health ministers, Pacific Health Ministers meeting will be held in Samoa on August. next year. And I'm very glad that the chairman, Madam Chairman, picked the right time, the first week of September, because that's our special festival known as the Wheeler Festival, ending with the Miss Samoa pageant. So, and that is a very, I want to invite you all. Don't miss that very important meeting in Samoa. So I'll go on to say something about the item 7. I am very pleased to give statement on behalf of Samoa government to heartily acknowledge the very comprehensive report by the regional director of our region, Honorable Dr. Saia Piukala. Samoa is grateful for WHO regional office support, both financially and technically in strengthening its health system and enhancing the provision of health services that are needed for promoting the health and well-being of our people. Every division of regional office had made huge contribution to Samoa's health system through first, strengthening our health security systems and public health emergency preparedness and response. Second, public health surveillances and laboratory services. Third, strengthening our health systems to achieve universal health coverage and health-related sustainable development goals. Four, NCT's neglected tropical diseases and infectious disease control and management. 5, strengthening our health information and communication systems. And 6, strengthening leadership, governance, and administration in terms of formulation and implementation and health policies and strategies, improving health facilities, and enhancing the capacity of health workers, to name a few. Samoa remains committed to work closely with WHO regional office and our country office in ensuring all our activities and programs supported by WHO are implemented in timely manner with the expected qualities. To conclude, Samoa would like to heartily congratulate the Regional Director, Honorable Dr. Saia Piukala, for his dedicated leadership in the region. It was not long before you were stood at the helm to steer the region, but your effort is noteworthy in particular. The new vision you had set for the region for the 2025 to 2029, weaving health for families, communities, societies in the Western Pacific region, through working together to improve health and well-being and save lives. Weaving in Samoan context is intergenerational, making deep ties visible between generations alive today and their far distant ancestors. Weaving is reconnecting us to make us truly human, our identities in our communities. Hence why I salute our regional director for using this concept, weaving, to describe the expected connection of all countries in this region, because weaving symbolizes the recognition of health and wholeness of a human by connecting us together to achieve our vision to improve health and well-being of all. You did great work and achieved many, your honorable regional director. May God's blessing be upon you abundantly. For our region, I pray for God's blessings to be with us. May He help build us to become great weavers for health, so we can generate good thoughts, innovate new ideas, and have the courage and know-how to bridge gaps that stop us from developing strong and sustainable health systems that promote health and well-being of our people. Before I finish, may God bless your Madam Chair and your Vice Madam Chair for all the work that you are going to face. And God bless Regional Director and all the staff of our office, regional office here in Manila. Thank you. Soy for.
Thank you very much to you, our Honorable Minister from Samoa. You know, I think you will agree with me. He is very special. He is the only one allowed to leave the country at this very important time. And then he's the only speaker that has been given way more time than the rest of you all. So you are very special, Honorable Minister. And I must say, you did make a correction to say that beside a good man, not behind, because your first intervention was behind. So thank you for correcting that. Now we will move on to our representative from Hong Kong, China.
Thank you, Madam Chair. I will keep my speech on time. Madam Chair, Regional Director Dr. Saia, Honorable Ministers, distinguished delegates, ladies and gentlemen. Allow me first to thank Dr. Saia, the Regional Director, for your very touching and inspiring presentation, laying out also the 5 visions of weaving health. And also my heartfelt congratulations to the Wipro team on your achievements in the past year as outlined in the Regional Director's report. Historically, Hong Kong, China is a city of migrants. Thus, we have a very diverse and vibrant culture, accommodating different religions, ethnic groups, and walks of life that make up one of the most densely populated places in the world. But we also are enjoying the best health indices in terms of life expectancies, infant and maternal mortality rates, etc. So this is attributed to a resilient and robust public health care system and also medical care, as well as our fundamental health policy of no one should be denied adequate medical care despite lack of means. So yet, Hong Kong, China still face similar challenges as other member states, including our demographic aging, declining birth rates, climate-related shocks such as extreme weather events, rise of NCDs and CDs, ever-escalating health expenditure, and also health disparities among our vulnerable groups. As such, Hong Kong, China is now embracing and substantial health reforms. We are revamping our primary care system, shifting from treatment focus to prevention focus, instituting carbon-neutral healthcare facilities, adopting innovation technology like telemedicine, precision medicine, etc. And we are also pressing forward health promotion and disease prevention initiatives, including tobacco control as well, and also adopting a life course approach. We are also mobilizing resources to tackle social and health issues of our vulnerable groups. Ladies and gentlemen, all the above reform initiatives align with the 5 visions of weaving health outlined by the Regional Director. So Hong Kong, China fully support these visions, and I look forward to the leadership of WHO in achieving health for all in the region. Hong Kong, China stand ready and also will continue to contribute our experience and expertise to the region. Last but not least, we would like to also extend our sincere invitation to the RD Dr. Saia to visit Hong Kong at an opportune time to advise us on our ongoing healthcare reforms. Thank you so much.
Thank you very much, Honorable Minister from Hong Kong, China. Now we will move on to our final speaker, the Honorable Minister from Papua New Guinea. Thank you.
Thank you, Madam Chair, Ministers of Health, distinguished delegates, and esteemed colleagues. I would like to take this time on behalf of Papua New Guinea in joining fellow health ministers of the region in congratulating Dr. Piukala on his appointment as the regional director for the Western Pacific region, and also acknowledging his exemplary leadership during this period of transition. We commend his vision and dedication, particularly in championing the theme of weaving unity for all, which aligns closely with Papua New Guinea's health priorities and aspirations. The Pacific region faces distinct health challenges, including the impacts of climate change, geographical isolation, and diverse cultural needs. Our regional director understands these complexities, and we are grateful for his leadership, visions, and plans in guiding us through them. His emphasis on unity and vision, his emphasis on unity and collective action resonates strongly with Papua New Guinea's commitment to advancing health security and tackling the ongoing burden of communicable diseases through strengthened partnerships and coordinated efforts. We remain committed to eliminating malaria, TB, HIV, neglected tropical diseases, expanding immunization coverage, and enhancing the preparedness for health priorities. We look forward to deepening our collaboration with WHO and regional partners to achieve these shared goals and ensure that our most vulnerable communities are protected. Papua New Guinea remains dedicated to contributing to the broader regional vision for sustainable health as attributed in the recently launched WHO PNG Country Cooperation Strategy 2024 to 2028, in ensuring that the actions we take today will lead to a healthier and safer future for all. Together, through unity and shared responsibility, we can weave a stronger, more resilient health system for the people of the Western Pacific. I thank you, Madam Chair.
Thank you very much, Honorable Minister from Papua New Guinea. As we don't have any further speakers, now I would like to call on our regional director to respond to the points that have been made.
Honorable Ministers, representatives from our member states, I am humbled and grateful for your kind words in response to the Regional Director's report, but more importantly, your support for our vision. What is most important is that all of you have been positive and supportive for our vision. And I'm already excited to implement our vision. But be mindful, I will come back to you and ask for your support to implement our vision. We need the vision document to shape the future, and indeed, your strong support for it is a form of validation for us all. Again, I'm grateful to the integrated transition team for their hard work, and I'm touched that our colleagues from Asia, like the Philippines, Brunei, China, Vietnam, have found that the symbol of the mat has resonated with many. If not the mat, it is the act of weaving that seems to resonate universally, as mentioned by Australia, the Marshall Islands, Samoa, and others. Many of you have shared your work and priorities like Brunei, Hong Kong, FSM, Philippines, Singapore, New Zealand, China, Malaysia, Republic of Korea, CNMI, and you're all emphasizing NCDs, primary healthcare, climate resilience, social determinants of health. And I also note that the health human resources is causing a great anxiety for all our member states. Australia and Malaysia have validated the critical importance of digital transformation. We look to Japan's leadership in universal health coverage and look forward to sharing of information and knowledge. Palau reminds us of the importance of mental health. Almost all of you have highlighted the climate crisis. Indeed, we need to put this at the top of our agenda. Some have mentioned the key role of the WHO collaborating centers, and I could not agree more that as we move toward implementation of the vision, the experts who are available, they do amazing work, and this can be amplified through WHO multilateral network. You have all mentioned leadership. I believe the leadership is in this room. This is the real leadership for our 1.9 billion people. It's right here. Let us work together for meaningful and strategic change. Leaders working together can do the impossible and even what is beyond imagination. China has mentioned my visit. I know that given the size and the diversity of China, there are not enough visits to do justice to your country. This is not the end of my reflection, but very much the beginning of an intense period of public health. In what might be a race against time as sea level rises, the NCD continue to kill too many too soon, and new diseases may arrive before we are prepared. The world of today is complex and challenging, but it is not something that we cannot collectively overcome. Coming together as a team. Our dilemmas are ironic. It just means that we can no longer have territorial, vertical, and tunnel vision approaches to health. We need to be strategic. We need to be comprehensive. We need to recognize local context, but we need to address shared challenges. We must be flexible. We must be practical. We must be proactive, and we must take care of each other. I appreciate your comments on Healing Hearts and your concern for the WHO staff. They are the backbone of our work. And thank you very much. We must do this work with our hearts, not just our minds. We must put our whole self into this in order to succeed. We must put our member states at heart to better serve them. With pure hearts and ready hands, let us get to work, inspired and inspiring everyone around us to achieve through our families, communities, and societies. And I want to end with one of Da Vinci quote, and I quote, "Knowing is not enough. We must apply. Willing is not enough. We must do." So ministers and member states, let us implement our vision to deliver better health outcome for the people of our region. And I thank you all. Thank you, Madam Chair.
Thank you very much to our Regional Director, Dr. Piukala, for those inspiring and very strong words of wisdom and in response to all the interventions that has been put forth by all of you, our distinguished representatives. Now, I would like to ask our Secretariat to please display on the screen the draft decision on the vision. The decision reads as follows. Can we all see the screen? Can I read? All Secretariat. One more, enlarge one more. In bold. I'll go ahead and read the display on the screen for the decisions made. WPR. Which one am I reading? This one? The Regional Committee, having reviewed and considered the Weaving Health document, expresses its strong support for the vision for WHO work with member states and partners in the coming 5 years. In particular, its priority areas for acceleration and scale-up, and its alignment with the global WHO 14th General Programme of Work. The committee also acknowledges the importance of mutual accountability and joint responsibilities of the WHO and member states in the success of the vision as articulated in the vision document. The committee wishes to express its appreciation to the regional director for the comprehensive consultation with member states and partners that guided the development of the vision document. May I take it that the regional committee is ready to adopt the draft decision that I just read out? I see no objection. The decision is adopted. Ladies and gentlemen, it is break time, coffee break time again for us. So please do not take your time. Be precise and come back into the conference room on time so that we can go home on time also. And get ready for our dance tonight. Thank you very much. Our plenary session will reconvene in 20 minutes at 15:45. Thank you. Ladies and gentlemen, just a gentle reminder, we will be starting very shortly in 1 minute. Welcome back, ladies and gentlemen. Before we move on to our next agenda, we have a mobility break. So may I please ask everyone to stand up, and we will join our Wipro dance company leads as they lead us with the mobility break. Thank you.
Walking with you on this island, guided by the grip of your hand. I can feel you holding my world. Ano ba itong nadarama? Oh shucks, ito ba'y pag-ibig na? Totoo ba ang
Thank you very much to our Wipro dance team. Did you enjoy that? Okay, there'll be more later on this evening. We will now move on to agenda item 9, panel discussion on climate resilience in healthcare facilities. Document WPR/RC75/4. I now would like to hand over to our Regional Director to introduce this item.
Thank you, Madam Chair, distinguished representatives. I'm pleased to present for your consideration document WPR/RC75/4 on climate resilience in healthcare facilities in the Western Pacific region. Climate change poses enormous threats to public health, and according to projections, climate change will cause an additional 250,000 deaths globally each year from 2030 to 2050. Many parts of the Western Pacific region are particularly at risk from climate change, including climate-related disasters. WHO has been working with countries and areas across the region to address these risks. By helping to build and strengthen climate resilient and environmentally sustainable healthcare facilities, we are working together to reduce the vulnerability of the most disadvantaged communities. This work is producing results. Member states are taking action. They are developing national guidelines for climate resilience and environmentally sustainable healthcare facilities. They are implementing initiatives related to climate resilience and environmentally sustainable healthcare facilities. They are undertaking greenhouse gas emissions, profiling, and assessment activities. But more need to join the Alliance for Transformative Action on Climate and Health. This alliance is a key vehicle for advocacy and action for climate resilient healthcare facility. There's only 8 member states in our region have joined the alliance so far. A distinguished panel will discuss specifically how the alliance has supported member states' efforts and its importance going forward. Much work remains to be done to build climate resilience in healthcare facilities, as well as to reduce the environmental impacts of healthcare. Meanwhile, the challenges posed by climate change to human health and the environment continue to grow in terms of consequences and urgency. The Regional Committee is invited to review progress made in building and strengthening climate resilient and environmentally sustainable healthcare facilities in the Western Pacific region. Now I am delighted to hand over to Dr. Esther Muna, Chief Executive Officer of the Commonwealth Healthcare Corporation, Commonwealth of the Northern Mariana Islands, to moderate our panel. Dr. Muna, thank you, and over to you.
Thank you, Dr. Piukala. We have 3 participants for this presentation. We have Dr. Antonio Lalambo, Minister of Health and Medical Services for Fiji, Dr. Snong Tongsna, Vice Minister of Health, Lao People's Democratic Republic, and Professor Nguyen Thi Lien Wong, our Vice Minister of Health for Vietnam. The objectives of this session is to highlight and share positive examples and experiences in implementing climate resilient and environmentally sustainable healthcare facilities. We also want to explain the benefits of joining the ATACH, Alliance for Transformative Action on Climate and Health, to increase membership within the region. I would like to turn it over to Dr. Mark Jacobs, Director of Pacific Technical Support, for his presentation, Setting the Scene.
Thank you very much, Dr. Munir, and good afternoon, ladies and gentlemen. You'll be pleased to know I have a very brief presentation to make, just to provide a little bit of background information before I hand over to the highlight of this session, which is hearing from our inspiring panelists. But as Dr. Munir mentioned, I'll just do just a little bit of background. Firstly, what do we mean when we're talking about climate resilient and environmentally sustainable healthcare facilities? It's what it sounds like. So we tend to define that term as facilities that are capable of anticipating, responding to, coping with, recovering from and adapting to climate-related shocks and stresses while minimising the negative impacts on the environment. In terms of what that actually means in practice, there's been quite a bit of thinking about this, and it's linked to the broader health building blocks of health systems. But fundamentally, there's four key components of these climate resilient and so on facilities. There's a component around health workforce. There's a component around resilient water, sanitation and hygiene and healthcare waste management. There's a component around sustainable energy. And there's a component around infrastructure and products and technologies that are beyond wash and beyond energy. And there's increasing emphasis. I mean, there's been work on this for some time, but there's increasing emphasis recently on low carbon interventions and technologies in health facilities. So what does this mean in practice, and what sort of things are important and what can be done? So if we think about, broadly speaking, the impacts on health and health facilities that are related to climate. Of course, we have impacts from extreme weather events. We have impacts because of heat stress. We have impacts because of air quality problems. We have impacts because of water quality and quantity. We have impacts through food security and safety. And we have impact on things like disease vectors, their distribution and their ecology. But if we think about that and what sort of things are important in those four different categories I mentioned before, and just some examples. So health workforce, of course, it's important for the health workforce to actually be able to access the health facility. So if the health facility is prone to being flooded whenever there's a major event, then that's part of the vulnerability of that facility. It's important to have basic things like knowing who the emergency focal points are for the staff, having emergency standard operating procedures so they know how to keep on providing services when there's some disruptions. Having systems in place to cope with increased caseloads and systems in place to protect health and safety of staff. For WASH, basic things like making sure that you actually have safely managed water and sanitation, you have adequate waste management, you have appropriate environmental cleaning, even when there are stresses because of the major events, for instance. Sustainable energy, of course, it's important for health facilities to have backup electricity supply, if they can. And in terms of broader infrastructure, of course, the facilities themselves need to be able to cope with or adapt to extreme weather events. They ideally should be adapted for vector control, so mosquito control and so on. Ideally, they should use low carbon technology, and they should have green building technology as well. So there's not a lot, I think, that's surprising in those sorts of examples or those sorts of lists. Now, one of the other things that we have is we have a lot of guidance that's already available. We know how to do a lot of these sort of things. We know how to help health facilities become more resilient. And there's a lot of information and guidance that's available. And so, for instance, there's a global repository of interventions for creating healthier environments more broadly, and it's got more than 500 actions that are practical and easily accessible. So that information is readily available to all countries. Another important tool we have, now in case you're wondering about that abbreviation at the beginning, just saying climate resilient in environmentally sustainable healthcare facilities without spelling out the words, it actually, we even have a way of pronouncing that unpronounceable abbreviation. We call it CRESH. So if you hear anybody talking about CRESH, that's what we mean. But so we have available a tool for assessing the vulnerability of health facilities. And so that enables us, and enables health systems, health managers, health leaders to understand the risks and the vulnerabilities and the impacts of climate change on their healthcare facilities. And it looks at what are the key areas to strengthen in each facility. And it can also help governments decide which are the most important facilities to strengthen first. We know it's a practical tool because it's already been used by a number of countries in our region, and it comes in both a paper version and a digital version. So we know that it's practical, and we know it's easy to use, and we know that it's useful. The final tool I'll mention, and it's already been mentioned both by the RD and also by Dr. Munya, is Attach. And really, fundamentally, for people who are not familiar with Attach, it has 4 broad objectives. One is about advocating for and enabling ambitious commitments and priorities on climate change and health. Another is about helping member states actually deliver on those commitments and priorities. Another one is about identifying and promoting evidence-based best practices and sharing those. And another is about advocating for and supporting development of innovative solutions. And so what's in it for countries being part of Attach? Fundamentally, by being part of Attach, it helps with advocacy on prioritising and elevating climate change and health within countries. It helps sharing knowledge between countries that are part of this network. And so a member country can easily access success stories and challenges from the experience of other countries. It's also a way of coordinating what are the needs of the different countries in the network and helping access finance and support. It helps with accountability in terms of encouraging progress, and it helps really promote further investment in these areas. And that is the end of my presentation. So thank you all for listening, and thank you, and I'll hand you back over to Dr. Munya.
Thank you, Dr. Jacobs. I would now like to ask the esteemed panelists several questions. The first question goes to, well, I'm going to read the question first. In your experience and implementing climate resilient and environmentally sustainable healthcare facilities, CRESH, what are some of the most effective strategies for making healthcare facilities resilient to extreme weather events and climate-sensitive disease breaks? I want to start with Dr. Alam Bulavo, Minister of Health for Fiji.
Thank you, and thank you for that question. In terms of the strategies that Fiji has done in terms of CRESH SIF, Fiji was again an early adopter of WHO's CRESH CF. And as such, in adopting the tools, we developed our own national guidelines on CRESH CF way back in March of 2021. And as such, it has guided Fiji's ongoing commitment to green healthcare and has been used to do a comprehensive climate hazard and vulnerability assessment of nearly 250 plus of our health facilities. And that report and its prioritized recommendations has been able to address urgent health infrastructure improvement needs in a number of healthcare facilities that I've mentioned, and it has put it into priority areas of immediate, medium, and long term. So in terms of the strategy, we adopted the tool that was developed by WHO and contextualized it to our very own in our national guideline. And as such, we have done the relevant things under the guidelines, and we have come up with the plan on how best we can improve and prioritize area of needs in terms of assessment and a structural improvement program. That is the strategy we have used right now, and to divide it further down, it's divided again into wash improvement, hand washing stations, health facility, waste management, training capacity building for health workers, and again, general infrastructure improvement works. One of the main component strategy that was also done is community engagement and education programs. That is a basic, in a nutshell, what Fiji has done in terms of the strategy and then what it has implemented on the ground. Thank you.
Thank you, Honorable Minister. Now let's hear from Dr. Tongsna, the Vice Minister of Health for Lao PDR.
Thank you, Dr. Ashret Muna, the moderator. On behalf of the Minister of Health of Laos, I am pleased to convey the warmest greeting to you all, and thank you for asking the question. I focus on the question, what are the most effective strategy for making healthcare facility resilient to extreme weather events? In Lao PDR, with the support of WHO, we developed HNAP, Health National Adaptation Plan, which includes several strategies. For this strategy, I would like to mention some most effective. Like the first is leadership and governance. We need strong leadership, we need strong government to lead us in fighting against any disaster. So we strengthen climate change and health policy and regulation. And that from the government, we could promote cross collaboration in response to any event sensitive to the health issue. Secondly, the second effective strategy, we consider health workforce. We need to healthcare workers to understand the situation, how to deal with, how to cope with the situation before central level providing support. So we doing awareness raising and training, capacity building. The third strategy is Ministry of Health of Laos. We give priority to a climate resilient healthcare facility. We consider that water, sanitation, hygiene is an important determinant for health. So we have conducted vulnerability assessment of district and healthcare centers. We aim to provide support them to mitigate the impact, because we cannot provide all together at the same time. We do assessment. All hospital and healthcare center located in the front area should secure wash service and flood-proof infrastructure. For example, with the support of WHO, we implemented the so-called Safe, Clean Climate Resilient Hospital Initiative, an early warning system which use climate and health data for timely prediction and respond to any climate-sensitive health event. The first strategy, we develop national baseline and target goals. After we assess the vulnerability, we set the target. With healthcare center, with this hospital, what are the targets to achieve the goals that we have set? That's great. Give us the motivation and dedication. The fifth point, the fifth strategy that we are implementing, that we are collaborating with WHO, development partners on global commitment, and we become member of ATASH. And those global initiatives give us a strong motivation to increase national effort and commitment. I really acknowledge all support from the WHO, development partner, and stakeholder that we are collaborating. We share, we learn from country experiences, and those are keys for our success in making our healthcare facility resilient to climate change. Thank you.
Thank you again, Dr. Tongsna. I would like to turn it over to Professor Wang for your answer.
Thank you, Muna.
Vietnam is one of the most vulnerable to climate change due to its geographic location. It is highly exposed to drought, seawater intrusion, sea level rise, flooding, and storm. And on average, Vietnam experiences 6 to 7 storms annually, with the most recent being Typhoon Yagi. Statistics estimate that the total damage of Typhoon Yagi to the healthcare facility in Vietnam is around 12 million US dollar. Severely affecting nearly 1,700 healthcare facilities across 13 provinces. Consequently, in recent years, Vietnam has adopted a range of comprehensive strategy and policy to develop CRESH in accordance with the WHO guidelines. In 2016, a national policy was issued to establish the clean and beautiful healthcare facility, setting standards that mandate greenery, clean water supply, well-maintained restroom, environmental sanitation, waste treatment management, and also the use of natural and energy-efficient resources. The second, climate change adaptation strategy have been integrated into the Vietnam National Healthcare Facility Infrastructure Policy planning that involve designing, renovating, and upgrading facility to withstand storm, flooding, landslide, saltwater intrusion, and also sea level rise. And the third one is digital transformation has also been prioritized, focusing on the application of the information technology in the medical services and the utilization of the telehealth to provide timely professional support to the lower level healthcare facility. The Ministry of Health has a piloted model to ensure a safe water supply for the healthcare facility facing the water shortages. Applying advanced environmentally friendly technology for treating infectious medical solid waste and prioritize investment to upgrade wastewater treatment system in the large healthcare facility to ensure the compliance with the national environmental standard. And in collaboration with WHO, Vietnam implemented several initiatives to improve healthcare facility resilient to the environmental challenges. These include installing desalination equipment for salt contaminated drinking water at Cù Lao Minh Hospital in Bến Tre province, a rainwater harvesting system at Bảo Nhai Health Station in Lao Cai province, and providing a surface water treatment system, a microwave machine for infectious waste treatment, and solar panels at the Yên Thành District General Hospital in Nghệ An province. Thank you.
Thank you to Professor Wang. And thank you, panelists, for sharing your effective strategies. The question for number 2 is, what are the key actions and practical solutions in improving the environmental sustainability that your country has applied to healthcare facilities? And please share with the forum some concrete examples of practices. I'll start this time with Dr. Tongsa. Yeah. Dr. Tongsa for the Vice Minister of Health. Yes. We'll start with you again.
Thank you again for the question, Madam Moderator. I would like to share what are the key action and practical solutions we have made. As I mentioned earlier, although we have several challenges, Laos has made some substantial steps in improving provision of wash, safe water, sanitation, and hygiene, and waste management services in central, provincial, and district hospitals. What are the action? First action is we rely on the global commitment. The global commitment was key and enhanced role of health sector in climate change and health adaptation and mitigation action. We made some significant commitments around COP26 to build a climate resilient and low carbon sustainable healthcare system and sign global climate health declaration during COP28 in Dubai, thanks to the support from WHO. The second action was to strengthen intersectoral collaboration and coordination. We cannot address these overwhelming challenges without working together with all relevant sectors and stakeholders. Health, environment, water, and waste management sectors are cooperating on climate adaptation and mitigation action. For example, HASNAP is health sector-specific climate adaptation strategy, but we developed and guided by the National Climate Change Strategy and nationally determined commitment that help us to increase coordination and collaboration on health, environment, water, and food sector, including data sharing practices. The third action was to implement the national regulation and standard in healthcare facility level and develop staff capacity. We introduced WHO guidance and tools for climate resilient, low carbon, environmentally sustainable healthcare facilities. The fourth action is Minister of Health Laos promote environmentally friendly technology, stop burning, incinerating waste, hostile waste, and promote green meeting and green office initiative that help to reduce plastic use, save water, energy, and fuel, and general utility costs such as reduced printing costs. Finally, another action is that we learn from international experience and share our experience with other countries in the region. Like ATAS is a platform for learning and sharing experience. It also bringing member states and development partners in addressing climate-related challenges together. Thank you.
Thank you again, Dr. Tongsna. Now we'll turn it over to Professor Wong. We'd like to turn it over to you. Thank you.
Yeah, thank you. To promote environmental sustainability in healthcare facility, Vietnam has implemented the following solution. The first, the government has issued policies encouraging the use of advanced environmentally friendly technologies in waste treatment, as well as the reuse and recycling of waste. A key focus is limiting the use of incinerator for medical waste treatment to reduce toxic emission like dioxin or furan. The Ministry of Health has issued a circular on medical waste management, including the minimization of the hazardous waste, plastic waste, and classify plastic waste for recycling. The national plan and roadmap for reducing the plastic waste was issued, which include reducing the use of non-biodegradable, non-biodegradable plastic bags and single-use plastic product by replacing them with eco-friendly or reusable alternatives. The second, as I mentioned in the first question, the model of green, clean, and beautiful healthcare facility have been developed, implemented, and disseminated along with WASH model in healthcare facility. These models are adapted to climate change and are suitable for the region frequently experiencing extreme weather conditions. The third, in the near future, Vietnam will issue a set of criteria for assessing the hospital environmental quality, as well as the health sector plan on green growth and a carbon emission reduction roadmap. And I would like to give an example of a model on environmentally friendly technology, steam sterilization equipment for treating infected plastic waste for recycling. The model has been applied at the Vietnam Sweden Uông Bí Hospital in Quảng Ninh province. Previously, the hospital generated about 22,650 kilograms of infectious plastic waste annually, which was incinerated by an external environmental company. However, since adopting the advanced technologies on contaminated plastic bag, plastic waste is treated and converted to be the regular plastic waste that can be recycled. The most significant benefit from this model is that it does not generate smoke emission and discharge plastic waste into the environment. Additionally, the hospital no longer incur plastic waste incineration cost, but generates income by selling regular plastic for recycling. Thank you.
Thank you, Professor Wang. That was exciting. Now we are still on number two, question number two, Dr. Lalambo-Lavulu. We'll turn it over to you.
Thank you. And in terms of the key actions and the practical solutions in which Fiji is undertaken, I've mentioned before that there was a tool developed by WHO, and we have contextualized it to our own and to our national guideline that acts as a guide on how we do things and prioritize certain areas. In terms of the key actions and the practical solutions, I believe one of the main things that have allowed us to implement this at the rate at which we are going is government commitment. That's one of the main things. There should be government commitment, otherwise a plan just becomes a plan on its own without implementation phase. So part of that government commitment was in our budgeting process, we had decentralized some of our minor works budgetary allocations right down to the divisions so that they do the work on their own while we monitor how they use those. And we have found that in terms of the process, and they have fast-tracked the work to where it is as we stand. Another key actions and practical solution is through development partners coming on board and assisting us with how we look after our infrastructure, ensure that it is climate resilient and environmental friendly. And we're very grateful with organizations such as JICA, COICA, MFET, DFET. They have come on board through respective governments as well as through WHO to assist us in identifying gaps in these areas and moving forward. Another practical solution is learning from past mistakes as you move forward. As I mentioned, we have just only adopted our national guideline in March 2021, and yet 3 years down the line, we're still learning and looking back and see how we can improve as we move forward. So those are the basic, I can say, in terms of what practical solutions is. And in terms of ATACH, yes, in our view, as member of ATACH, it has elevated the voice of the Pacific to a level that we can participate at high-level meetings through the Pacific. And that is, again, what we're currently doing right now. And I leave it at that for the moment.
Thank you, Dr. Lalambo-Lavulu. The last question, thank you again, panelists. The last question is, one of the most important aspects in building climate resilient and environmentally sustainable healthcare facilities, CRESH, is ensuring predictable financing. How is the Alliance for Transformative Action on Climate and Health, ATACH, helping you maintain the gains for crash implementation. And I will start with Dr. Wang, Professor Wang.
Thank you. In Vietnam, in the context of significant financial challenges faced by the healthcare facility, along with the severe impact of climate change and extreme weather, ATTACH will assist Vietnam in collaborating and connecting with the partner to mobilize resources. The goal is to establish and sustain the implementation of policy and strategy for crash. With the support of ATTACH, Vietnam has joined a global initiative to apply for funding from the Green Climate Fund, aim at supporting climate change and health activities over the next 5 years, 2026 to 2030. We are optimistic that this initiative will significantly enhance the resources available to strengthen the climate resilience of our health care facilities. Furthermore, ATTACH will also support the implementation of green, clean, beautiful, and sustainable healthcare facility models that are capable of adapting to climate change and environmental incidents. Assist in training human resources in Vietnam for the execution of policies related to crash, facilitate participation in the international conferences to share and learn from the experiences of other countries in the world, and help build a monitoring system and database management for crash. Thank you.
Thank you, Professor Wang. Now we'll turn it over to Dr. Lalambulavo.
Thank you. In terms of ATTACH and financing, again, as I've mentioned before, ATTACH has provided a global platform in which countries such as Fiji, which is a member of ATTACH, can voice its concern day in and day out in terms of the challenges that are not only faced in Fiji, but within the Pacific region as well. And as such, we have seen that in doing so, and through other platforms within the global perspective, we have seen that in terms of financing, a good example would be just the recent financing from World Bank through WHO. That is one of the few examples of that. So again, there are, as I said, benefits of it, and one of the main examples I just gave. So I'll leave it. Thank you.
Thank you, Dr. Lalambulavo. And last but not least, Dr. Tongsna.
Yes, thank you again. We all know that financing is the most important aspect in building crash. How ATTACH helping us maintain the gain for this implementation. I know that Fiji, Vietnam, and Laos, we joined the ATTACH initiative since 2022. Therefore, we all have joint activities initiated by the ATTACH. I would like to congratulate all panelists for this achievement. The ATTACH was established to climate resilient, sustainable, and local health commitment and implementation. Beneficiaries are member states that made the commitment during the COP26, and results are to achieve the commitment. The commitment itself is critically important and should be implemented. So sustainable funding mechanism is important for long-term sustainable resilience. So many countries, low-income countries, have so many challenges. I would like to share one innovative approach, which is integrating climate and health data to set up early warning system in the health sector. This integrated approach saves time and also money. The early warning system is being established to predict and respond climate-sensitive diseases before they become crisis. It helps us to mobilize resources by demonstrating our government commitment to address climate and health priority by taking innovative approach. Honorable delegates, we do not have time and resources to be wasted for fragmented approach anymore. Advancing climate and health goals and targets require a whole of society and whole of government approach. Under the strong leadership of government, alignment of development partners, and cross coordination, we would minimize duplicated effort. That will be crucial to drive systematic and transformative change toward climate resilient society. The government of Laos is committed to continue strengthening the health system to be resilient to the impact of climate change and health with our development partner. Thank you.
Thank you. Thank you, Dr. Tongsna. And thank you again, Professor Wong, Dr. Lalambo, and Dr. Tongsna. Thank you for your answers, for your insights, and your response to our questions. Now, I would like to open the floor for interventions. The queuing list will appear on the screen. Thank you. Yes, may I call on the representative from Solomon Islands?
Thank you, Chair. First of all, Madam Honorable Chair, firstly on behalf of the Solomon Islands Government of National Unity and Transformation, wish to congratulate you for your unopposed election to the chair of the 5th of the Regional Committee meeting for the Western Pacific region. Congratulations to you and your vice and your rapporteurs. God bless you all. I wish to congratulate Dr. Saia for his outstanding work as our regional director and for the great work he has done through his leadership. And I'm looking forward to work closely with him and all of you to build better health outcomes for the region. Also wish to thank the outgoing chair and his team for their great work and wish them well for their endeavors. Thank you all, the WePro team and member state countries for supporting the vision of our regional director. Let us sit down and wave our health strategies as a Western Pacific family to achieve health for all. Thank you for giving me the floor to share our local experiences at this highest level panel discussion. I would like to share some of the steps we are taking to ensure that our healthcare facilities are resilient in the face of climate change. On healthcare facility assessment, we are integrating climate resilient, environmental sustainable healthcare facilities as part of our ongoing assessment of healthcare facilities across our country. The healthcare facility plans will be incorporated site-specific climate-proofing measures so that the facility can be able to deliver essential services during the times of emergencies. This initiative was launched in September this year, 2024, with our National Referral Hospital leading the way in implementing the needed changes, such as retrofitting to make the facilities safe, clean, green, and climate-proof. On our health interministerial collaboration and in enhancing the development of our Health National Adaptation Plan, my ministry is working with the Ministry of Environment, Climate Change, Disaster and Meteorology to carry out the Solomon Islands Integrated Vulnerability Assessment, which includes mapping landslide, flooding, and sea level rise, enabling the ministry to see which existing facilities are great risk and relocated healthcare facilities. In ensuring civil society engagement, our local and international NGOs in country are working closely with my ministry in responding to the needs shown through the health facilities assessment. Healthcare facilities has been supported with construction of needed sanitation facilities that take into consideration the resilience and disability lenses. All these initiatives are not in isolation, but part of my ministry's role delineation policy implementation, which recommends that health infrastructures must meet certain minimum standards in terms of their climate resilient healthcare facilities design. This, I believe, will address vulnerability of climate change to healthcare facilities that we have. I urge all of us to act now to save lives of our people in the Western Pacific region. Our action now through waiving health strategy will and hopefully addressing etiologies of climate change to build a better, healthy future of our children and the children of our children. That choice is on our hands, whether we address the impacts or we address the etiologies of climate change to build climate resilient healthcare facilities. Thank you, Chair.
Thank you, Honorable Minister. May I call on the representative from Philippines?
Thank you, Madam Chair. The Philippines is ranked as the most at-risk country to extreme natural events and negative climate change for 3 consecutive years. Much has been said about the Filipino spirit. However, we recognize that above this, the country must put forth more resilient and sustainable policies, governance mechanisms, and infrastructures. For us, the stakes are existential. The consequences generational, and the policy environment increasingly complex. However, we recognize that this is not unique to the Philippines, but is also is a common threat to countries in the Western Pacific. The highest level of political will and the recognition of the intricate link of health and well-being to the planet's health is key to building a resilient and sustainable future. The Philippine President's commitment to fulfill national action plans and climate change highlights the broader effort to achieve a climate-smart and climate-resilient country. This year, the Philippines had the honor of hosting the board of the Loss and Damage Fund, further solidifying our leadership in the global fight for climate resilience. By representing nations that face severe climate-related changes, we demonstrate our commitment to global climate action. The irrefutable nexus of climate change and health necessitates all whole of government and whole of society approaches. The country's health sector 8-point agenda underscores readiness for health crises and emergencies. A key strategy to prevent the disruption of health care services is to strengthen the climate resilience and environmental sustainability of health facilities. The country's Climate Change Commission, National Solid Waste Management Commission, the Health Department, and Association of Hospitals and Health Workers work collectively for national plans, policies, and framework for green and climate-smart hospitals. The country's plan include constructing environmentally friendly hospitals and incorporating climate change adaptation into our disaster risk reduction initiatives. Our Green and Safe Health Facilities Manual and its accompanying Green Viability Assessment Tool contain performance standards in governance, energy efficiency, water efficiency, sanitation and hygiene, healthcare waste management, environmentally resilient health facility, site sustainability, material sustainability, and indoor environmental quality. We support global partnerships for climate resilient and environmentally sustainable healthcare facilities through our commitment as a WHO member state to become carbon neutral by 2030. We developed technical guidelines and standards for green and safe facilities to respond to the global call of minimizing the carbon footprints of the health sector while still continuing to provide quality health care, thereby setting the minimum green and safe standards for all hospitals and other health facilities. The Philippines is also a member of the Alliance for Transformative Action and Climate and Health. We recognize the value of evidence and science-based policies to end plastic pollution through an instrument being developed by the WHO. It is important to work closely with the Secretariat to avoid duplication of efforts and maintain WHO standards of quality assurance in the development of technical guidelines on air quality, drinking water quality, and chemicals, and workers' health. Thank you very much.
Thank you, Honorable Minister. Yes, you can applaud. Okay, I would like to call upon the representative from the Marshall Islands.
Honorable Madam Chair, Dr. Brown, Regional Director Dr. Saia Piukala, Moderator, CEO Esther, Excellencies, colleagues and panelists, Yakwe, all protocols observed. I want to start by expressing our appreciation for the shared experiences and insights from the panelists on this critical agenda item. Your contributions enrich this discussion and help us move forward in addressing the health impacts of climate change. The Marshall Islands is deeply grateful to all the member states for your support in electing us in the UN Human Rights Council. As we assume this role, climate change, climate justice, and nuclear accountability will remain at the core of our advocacy as they are fundamentals to human rights and survival. As a healthcare advocate and a mother, I am profoundly moved by the urgency of our challenges. Our people live at the intersection of two grave crises, climate change and the nuclear legacy. The Runa Dome, filled with nuclear waste, is leaking into the ocean, while rising seas threaten to wash away our homes. The health of our people and the future of our children are at stake. Excellencies, picture a child on one of our islands, her home constantly battered by rising tides, her family crops destroyed by salt water, while she also faces the silent threat of nuclear contamination. Fathers, mothers across our islands worry about this daily, wondering what future we are leaving for our children. It is for them that we must act now. To protect our people, we have developed a national climate change and health policy and a national adaptation plan that prioritize health and resilience. We are proud to partner with WHO on the climate resilient, environmentally sustainable healthcare facilities and work closely with our National Energy Office to reduce the carbon footprint of our health sector, one of the largest energy consumers while maintaining vital services. Additionally, we are conducting health facility readiness and service availability assessments in a climate change and health integrated vulnerability assessment to guide future health national adaptation plans. These efforts will help us address the compounded risks our people face. We also appreciate WHO's leadership through ATTACH, which fosters collaboration in our shared resolutions. The Marshall Islands stands strong, guided by the hopes of fathers, mothers, and communities committed to protecting and health and dignity of all. Thank you, Komultada.
Thank you, Honorable Representative from the Marshall Islands. I would like to call upon Tuvalu.
Madam Chair, I join previous speakers in congratulating you and the Vietnam Minister of Health on your elections as chairperson and vice chair of the 75th committee session of our Western Pacific region. I would also like to congratulate the regional director, Dr. Saia Piukala, for his inspiring vision for our region that he has presented to us this morning. I also thank the
WHO representative to the South Pacific, Dr. Mark Jacobs, for taking time to visit Tuvalu this year. I also like to thank the regional director in advance for his planned visit to Tuvalu. Tuvalu is at the highest risk from climate change and climate-related disasters and diseases. As such, Tuvalu prioritizes its work and strategies to ensure climate-resilient health system. In August this year, and with the technical support of WHO, we launched our new public health strategy for the next 4 years, 2024 to 2027, envisioning an empowered Tuvaluan population through strong public health programs and services. Environmental health is our first strategy, a strategic priority area in which it aims at ensuring the ongoing protection of health of all people in Tuvalu through disease monitoring and safe food, water, and living environment. Our strategic priority area include health promotion, nutrition, maternal and child health, non-communicable diseases, communicable diseases, epidemiology, surveillance, and research. Chair, the main challenge before us now is the timely implementation of public health strategy. Limited technical, financial, and human resources are the key challenges that I can foresee will impact our capacity to implement our plan. Some of these challenges have also contributed to the slow progress on our project under the Global Environment Fund, GEF. Building resilience of health system in Pacific Island leads developing countries to climate change. Despite the challenges, I acknowledge WHO, the World Bank, and the Asian Development Bank, and the UNICEF for their continued support. I would also like to express our sincere gratitude to our traditional bilateral partners, Australia, New Zealand, and Taiwan, for collaborating closely with us to address the various gaps and challenges in our health system. We hope to continue working closely with you all as we try to strengthen our health system. Tuvalu stands committed to achieving universal health coverage and our region's vision. Fafitailas. Thank you.
Thank you, Honorable Minister, for your intervention. Before I call on the next representative, I do want to announce that we have a hard stop at 5:10. So if we miss you on your intervention, I believe you can just email the intervention to the email that was you can find actually on your app, and I think it's anyway. Oh, I won't even attempt to do that. But just do email your intervention, and it will be recorded. So I will turn it over to the representative from the U.S. territories.
Good afternoon, and Hafaday from the U.S. territories and Guam. Congratulations, Madam Chair, on your election. It is so wonderful to have a fellow female colleague in the leadership role. It's wonderful. To Regional Director Piukala, thank you for your very inspiring as well as very moving words this morning. I think a few of us was very emotional, and that's because it's so wonderful also to have a fellow Pacific Islander in your position. And so we're so grateful and very, very, we look forward to your leadership. Honorable Health Ministers, ladies and gentlemen, The United States Territories of American Samoa, Guam, and the Northern Marianas is grateful to WHO, WIPRO for the continuous efforts to ensure there are climate resilient and environmental sustainable healthcare facilities in the Western Pacific region. As the Western Pacific region is geographically prone to natural disasters, including typhoons and earthquakes, which can further strain the health services and infrastructure, support to responding to these emergencies is critical as healthcare facilities need to be ready to respond immediate threats to life and health and disrupting healthcare delivery that can lead to long-term health consequences. Most of the healthcare facilities in the territories are aging, and health leaders worry of its availability and accessibility when disaster strikes. In the last decade alone, Guam and the Northern Mariana Islands experienced extremely powerful typhoons, putting the health system that is already struggling to meet the health needs of its people at risk of not being there at all. While the island territories have shown that they are resilient, more efforts need to be made to ensure that the health infrastructure is strong and prepared to withstand climate-related disasters and extreme weather events. We support and hope to accelerate our facilities to join others in the region as a climate-resilient and environmentally sustainable healthcare facilities, CRESH, to ensure we are ready to serve our people no matter what the conditions our environment brings on. Thank you and good afternoon.
Thank you, Arith. Yes. Don't forget to clap. Thank you, Honorable Minister. May I call upon the representative from Samoa?
Madam Chair, the Vice Chair, and also the floor to all the Minister and delegation from our Western Pacific region. Ladies and gentlemen, climate change, as we are all aware, is a major global threat to human health and puts tremendous pressure on our health systems. Hence why Samoa is very committed to implement integrated climate resilient and environmentally sustainable healthcare facilities programs through whole of country and multi-sectoral approach. We highly acknowledge the support of our technical and development partners that assist Samoa with building climate resilience healthcare facilities not only in the urban area, but also in rural health facilities. At the moment, the government of Samoa, with the assistance of the World Bank PFR program, is currently working on extension of rural health facilities with doctors and nurses residents in rural areas, as well as building the capacities of the health workforce in rural health facilities to prepare and respond to impacts of climate change on health services provision in rural health facilities. And Samoa shows its sincere appreciation to our technical partners, such as WHO and SPC, for this. We will continue to work hand in hand of health development partners and Samoa's have to ensure that all health facilities, both in rural and urban areas of Samoa, are climate resilient by the continuous implementation of our climate adaptation strategy for health through whole of country multi-sectoral approach. Thank you very much.
Thank you, Honorable Minister. I now call upon Australia.
Thanks, Chair. Thanks to the Secretariat for giving us a renewed focus and priority in this area. Thanks to the panel for sharing many examples and spearheading some of the ways that we can address action on climate and health. Australia, we launched late last year our first ever National Health and Climate Change Strategy, which sets up for us a whole of government action plan to better prepare our health system. As part of that strategy, we're actually working on national guidelines to actually help hospitals and a range of players in the health systems to undertake more nationally consistent climate risk assessments to deliver to actions that are kind of measured across the whole nation. Happy to share this guidance and any of the lessons that are coming from that with colleagues that may be interested. Another important part for us of that strategy is stepping up our international collaboration. Australia co-sponsored the WHO resolution on climate and health in May, and they're really pushing hard for an action plan to come out of that to ensure it translates into our implementation. And in particular, I want to see that focus on the link between headquarters and WHO regional offices to make sure that also comes into effect. We also believe it would be useful to strengthen the international collaboration in parts of our region. Australia recently participated in the first ever Pan-Pacific Conference on Climate and Health with WHO and 12 other Pacific Island countries. The conference proposed the creation of a Pacific network on climate and health to improve coordination and sharing of best practice. This is something that Australia would be open to considering the best way forward. Thank you very much.
Thank you very much also, Honorable Minister. And I will call upon USA.
Thank you, Chair and Madam Chair and the Regional Director, Dr. Piukala, for this incredibly important agenda item. I actually would like to cede my verbal intervention. We will submit it in writing and to cede that time to the delegates that follow. But thank you again for this incredibly important topic.
Thank you for that action. Thank you. I will call upon Palau.
Thank you, Dr. Munya. We'll follow suit with the U.S. I know that the Honorable Minister from Samoa is hungry already. So we'll submitting our intervention online, but please do go and read it because I will be checking. Thank you.
Thank you again for that. That's the spirit, yes. I will now call upon Malaysia.
Thank you, Madam Chair. I will just make it very short and sweet. Malaysia recognizes various risks of climatic hazards and impact of climate change on the nations in the region, and constant efforts should be made to reduce the consequences of climate change, and each member country should respond appropriately based on the local context. And I think Malaysia also wishes to thank WHO for its strong commitment and efforts as the Secretariat for the Alliance for Transformative Action and Climate and Health, ATACH, and as the Asia-Pacific Regional Forum on Health and the Environment. These two platforms provide an excellent forum and networking opportunity for member countries to share the best practices and address environmental, climate change, and health-related topics. As one of the 23 countries from the Western Pacific region that endorsed the Declaration on Climate and Health at the 28th United Nations Climate Change Conference, or COP28, in December 2023, Malaysia is committed towards developing a climate-resilient and low-carbon health system to achieve carbon neutrality or net zero by 2050, strengthening the health sector preparedness and response to extreme weather events, improving surveillance and early warning system, and conduct vulnerability and adoption assessment for community. Malaysia has been implementing a key adoption measures in its hospitals since 2015 to enhance resilience against climate change. To date, 67 out of 140 hospitals have been certified as green buildings, and 30 health clinics have conducted a pilot project on low-carbon healthcare facility initiative. These effects also focus on green building practices, integrating renewable energy, and ensuring sustainable healthcare operations that are climate resilient. Research was also conducted to see the vulnerability of healthcare facilities and communities in the small island in east coast of Peninsular Malaysia and East Malaysia in Sabah. Malaysia is committed to continuously strengthen and enhance resilient health system in the face of escalating climate change impact. Thank you, my Chair.
Thank you, Honorable Minister. Last but not least, FSM, we do have a few minutes, seconds for you. Thank you.
Thank you. Thank you, Madam Chair. And as the last speaker of the day, I will be sure to utilize all 5 minutes. Climate change presents significant changes and challenges to the achievement of the 2030 Agenda for Sustainable Development, especially in the context of health systems. For the fairy states of Micronesia, the impacts of climate change are not just theoretical, they are daily reality that threatens the health and well-being of our people. Rising sea levels, extreme weather events, and the shifting weather patterns all contribute to increased vulnerabilities in our healthcare systems, which are critical lifelines for our communities. The ability for healthcare facilities to deliver essential care is jeopardized by these climate-related challenges, disruptions to infrastructure, support systems, and supply chains, along with the increased demand for climate-related health issues, strain our capacity to provide care. This is particularly critical during the extreme weather events, which can cut off access to services, increase patient loads, and expose both patients and healthcare workers to greater risks. While we work to adapt, we must also recognize that health systems are contributors to climate change, generating about 4.6% of global greenhouse gas emissions. As we strive to build climate resilient and environmentally sustainable healthcare facilities, we must also reduce this footprint while ensuring that healthcare remains accessible and effective. In the Western Pacific region, progress is being made, yet challenges remain. Financial and implementation barriers, knowledge gaps, and the need for better planning hinder our progress. Our capacity to withstand future risks, whether from flooding, prolonged droughts, or extreme storms, needs strengthening. We must improve our preparedness and build the skills of our workforce to assess the plan for these risks effectively. We encourage the Regional Committee and the WHO and our regional partners to continue fostering a collaborative approach, sharing lessons learned, and focusing on resource mobilization. With shared commitment and action, we can ensure that our health systems not only survive, but thrive in the face of climate change, providing the care our people deserve and building a sustainable future for all. Thank you.
Thank you very much, Honorable Representative from our FSM. I do want to thank all of the representatives for their interventions, but before I turn it over to Dr. Okayasu, I want for very brief remarks. I want to again thank all the panel. Please let us give a round of applause for the panel. Thank you. Okay. I will turn it over now to Dr. Hiromasa Okayasu for his very brief remarks. Thank you.
Okay. Thank you very much, Dr. Muna, for your excellent facilitation when the time is limited. So we again thank all the member states for their participation and an intervention, sharing their experience in building climate resilient and environmental sustainable healthcare facilities, CRESH. So today's panel discussion provided insight into valuable experiences and ideas to help all of us to advance our common mission to enhance the resilience of healthcare facilities. First of all, member states confirmed our initial presentation that action for climate resilience in health facilities are very broad. It includes the health adaptation plan, vulnerability assessment, and then implementation with the local engagement, and then it also includes actions such as WASH and renewable energy and an infrastructure improvement. These actions help not only ensure health facilities remain functional during and after climate events such as storm, floods, and drought, but also prepare for other emergencies like volcanic eruptions or earthquakes. Some member states also emphasize that building human resource capacity for climate preparedness is crucial. And especially countries like Laos, Vietnam, Tuvalu, Micronesia highlighted their work on the building both national and local healthcare workers' capacities. And the Philippines indicated the specific implementation of a green and then safe health facility manual. Another important topic was that WHO Alliance for Transformative Action on Climate and Health, ATTACH, was as an important platform for countries. For instance, Vietnam, Laos, Fiji shared their experience using ATTACH as a platform for knowledge exchange, political commitment, as well as resource mobilization. So we do encourage member states who have not joined ATASH to consider this opportunity today. And we sincerely regret that we could not accommodate some member states' interventions today, but team will review all of them later and then incorporate them into our work. Again, we appreciate member states' strong interest and then commitment. WHO remains also dedicated to collaborating with our member states to build climate resilient and environmental sustainable healthcare facilities. Thank you again. Thank you again. And then now over to you, Chair.
Thank you very much to Dr. Esther Muna for moderating the session, and also to all our panelists. Thank you very much. And I also acknowledge Dr. Piukala for also presenting for this session earlier on. Now, ladies and gentlemen, we have come to the end of our day one, first day. Let us all give a round of applause to everybody that's present in the room. Thank you very much. Ladies and gentlemen, now, just a reminder, friendly reminder, that we will reconvene back here tomorrow at 9 a.m. in the morning. There will be no excuses from all our honorable ministers, because the dinner tonight is a non-alcoholic dinner event. So make sure that everybody is here on time, 9 a.m. we will start. And we will see you all at 6 o'clock tonight at the dinner hosted by our regional director in Manila Hotel. Now I will hand over to our Director of Administration, Dr. Tamas, to remind us of the details. Thank you very much.
Thank you, Madam Chair, and I'll be very, very brief, I promise. So, firstly, directly after this plenary session, we'll have the first meeting of the rapporteurs. Kindly follow me and I will show you the way. Transport to your hotels, Manila and Admiral Hotel, will be available right after this session, just outside, for those of you who wish to refresh and change before the dinner. The session tomorrow, as you have heard, starts at 9 with the address of Honorable Madam Chair. In this conference hall, certainly tomorrow's highlight, so indeed, please be in time. Transport from the hotels tomorrow will be posted daily in your hotels, so please check in the lobby the schedules. We worked on the security check, so it'll be a bit quicker tomorrow, I promise. Tomorrow, our special exhibition, which is titled Museum of the Health Futures, will open already at 8 a.m. for those of you who want to visit, and there will be special shuttles from the hotels at 7:30 and 7:15 respectively. Finally, the most awaited announcement, which you already heard for tonight, is a traditional RCM dinner hosted by our regional director, Saia Piukala, in the Fiesta Pavilion of Manila Hotel, this evening starting at 6 p.m. For those staying in Admiral Hotel, shuttle service to Manila Hotel will be available. Please consult again the schedules in the lobby to be in time to start at 6 p.m. And finally, make sure to put on your dancing shoes, wear comfortable clothes, and look forward to a memorable evening with healthy foods, no alcohol. Let us have a good time together. Thank you, Madam Chair.